is more than $12,000 and expected to double by 2016. Costs are hurting working families. Uninsured face severe medical debt. Every 30 seconds, someone files for medical bankruptcy. More people are uninsured in 2006 and 2007. 89.6 million people under the age of 65 were uninsured for some or all of that 2-year period. And today, 47 million Americans are without health insurance, including 9 million children. The lack of health insurance hurts us all. The average increase in family health insurance premiums is expected to go from $1,500 per month in 2010. Today's health care system is wasteful and inefficient. Private insurance companies spend 15% of their money on administrative costs, whereas large public plans, such as Medicare, spend less than 3%. Insurance and drug companies are profiting. Health insurance companies' profits have increased 1,084% in the last 5 years. Health insurance CEOs average $8.75 million in compensation per year. One insurance CEO alone, Aetna's Ronald Williams, brings in over $32 million a year. The American people want the healthcare system fixed. 90% of Americans say the U.S. healthcare system needs to forego fundamental changes or be rebuilt completely. The bottom line is that we need to make sure everyone has health insurance in this country, period. Working Families Win supports guaranteed care by expanding Medicare or the implementation of similar programs to provide basic coverage for all. Now, as a member of Congress, would you support the U.S. National Health Insurance Act to expand Medicare to all U.S. residents, or comparable legislation to secure comprehensive, high-quality, and affordable health care for all?
Thank you. Well, as a member of Congress, I want to get in there and make sure that we address the health care needs of our country. We've been talking about it for decades now, and we have not accomplished what we need to do, which is to make sure that health care is available, affordable, and quality health care for everyone. I need to be sent to Congress as a member to be able to get in there and figure out what is the best way to accomplish that so that everybody has the access that they need. And there could be no one silver bullet necessarily that's going to do that. I need to get in there and be able to understand how we can accomplish our goal and get results that the people of the 4th District can tangibly grab a hold of and see. And just like you said, the cost of health insurance is expected to double again over the next 10 years. In the last 8 years since George Bush has been in administration and Tom Latham has been there for 14 years, we've seen our health care costs increase in the last 8 years, almost double. And we cannot sustain that. There are not very many families in the 4th District that can handle that rapid increase, and we all know that the salaries and wages and pay of our people in the 4th District aren't increasing. So we have to solve this problem. I think about situations that I've come across in my travels here during the election season, and a lady that's just a couple years older than me just dropped dead one day, and everyone was pretty much shocked by that because she seemed so healthy. Well, talked to her sister, and it turns out she'd had a blocked carotid artery. And I thought, I actually had screening to check on that for myself a couple years ago because it was recommended when you reach a certain age. And Connie, the lady that dropped dead, didn't have health insurance, hadn't been having physicals, didn't have the opportunity to have that screening. And, had she had that, she could have had another 30, 35 years of good living to do. And it's just not right that people are, facing those kinds of consequences because they cannot afford the basic care that is available to all of us here, but we can't necessarily all afford it. One thing that we absolutely can do is look after the prescription drug costs. We've got so many seniors that are trapped in a donut hole, and they're just one medical bill away from financial disaster. And it's just unconscionable to me that we can manufacture drugs here in this country and they're sold cheaper in Canada. So what I would really focus on is to get some short-term relief, is make sure that we can work on this prescription drug situation that allows the government to negotiate for costs and lower the costs that we're paying here in this country and be able to get those drugs back in from Canada as long as we're certain that they're safe and follow the labeling requirements. Now, I think about the 14 years that Tom Latham has been in Congress, and we've not seen anything resolved in this matter, and we absolutely need to make sure, because it's something we have to be sure that our Iowans have access to.
Thank you. I invite Max up to ask our next